Last week I was at Laura's hospital and I was in a lecture theatre. It was absolutely packed, and the topic was hip pain, and the consultant surgeon's thesis was that we've been looking at hip pain wrongly, and that what we should be regarding is a muscle disease that leads to the arthritis. So instead of replacing the damaged hip, we should first of all encourage the patient to become fitter. And he's been running a trial and finding that a lot of patients with moderate pain find just regular non-weight-bearing exercise strengthens the joint and means they either don't need the operation or it can safely be postponed. So he's looking at, first of all, the origins of these, but also, more importantly, the care pathway. We've talked about procurement. I'd be interested in whether you're looking at care pathways as well as a possible way of both reducing cost and improving care.
Well, ultimately, wouldn't that just be the perfect way to end a career? That we've now changed the health of the local community so as to have a knock-on effect that will reduce our carbon footprint of our local healthcare provider. I see that as a long way off. But perhaps I'll illustrate the way my mind is going with another story. My wife is a family practitioner in Southampton, and she, like me, shares an interest in trying to reduce our own carbon footprint. So we've thought, well, let's do this scientifically, and let's buy an electric bicycle. The reason she needs an electric bicycle is that she has to travel about 4 miles from one end of the practice area to another. She can't really do it on her own bicycle without arriving in a slightly sweaty condition. So the electric bicycle was bought, and we've looked at the amount of energy that it uses in terms of electrical energy in order to charge it over the course of time. But in addition, as she is a general practitioner, we've got all her fuel receipts, and we've compared the two, and we've found that she's reduced the amount of fuel by 4,000 litres in the course of 1 year by moving from totally dependent upon the car to being intermittently dependent on the car when she's on call, and other times she's used her bicycle. In terms of energy, that works out around about 4,000 kilowatt hours. So,
but she's also influencing her patients.
I've tried to pursue that before our meeting today with her practice, and I asked them, do they regard her as slightly cranky? No, we haven't got any evidence to support that. Does it influence their behaviour of the patients? I'm sure it must, but I have no evidence to support their contention.
Spoken like a true scientist. There's a question related to that I'll jump to now, because it comes from a GP down in Weymouth. And he says, how do we move our focus from expensive hospital treatments for established diseases to put more effort into community or environmental factors to prevent people coming ill in the first place?
In the days of fund holding, again, I refer to my wife's practice, she had the opportunity to put together a small group that was aimed at young teenagers. It gave them somewhere to go. It gave them an organisation that they felt cool in, but there was no smoking and there was no drinking. And it concentrated upon the development of a healthy life. Now, many of those patients who were teenagers at the time are now adults with young families. And whilst we haven't ever managed to look at the impact that has, in general practice, where a patient may be with you from the day they're born into their middle years, the opportunity to change behaviour, I think, and toward a healthier existence has always to be there. Can I do it as an anaesthetist? I think probably not.
Well, think of Lord Darcy and what he achieved.
Well, oh my goodness me. He did, by perhaps but could I achieve that? I'm not so sure.